What differences does modern technology make at a dental office? Hello, if you haven't seen one of these videos, I'm Dr. Eck. I'm a comprehensively trained general dentist. And when it comes to the latest technology, I really want to make sure that I'm getting the best treatment. As if I was going to treat one of my family members or myself, I want to make sure that the patients are getting the best treatment that they can get. So I invest a lot of time in trying to make sure that I'm researching the latest technology and training myself so that I can use the latest technology in order to bring the best treatment to the patients that I possibly can. So some of the differences that I see in a dental office, one of my favorites is that 3D scanner. It used to be that you would have to use those gooey impressions, fill a whole tray with goo and then put it in someone's mouth. Of course, that's something that in some cases helps someone to get things more efficient in another way. So using old technology is fine in some cases. However, if you use one of those 3D scanners, if you've ever had one, you know that it makes an enormous difference to be able to just scan right inside your mouth and then to have this beautiful digital blueprint of the way that your teeth truly look right on the computer screen for the doctor to look at and for you to look at. It's helped in a lot of discussions to help people see exactly what we're talking about. Another piece of technology that makes a huge difference, this digital cone beam scanner. It's a three-dimensional x-ray when a cone beam scanner is used to take images of your teeth. There are a lot of things that a two-dimensional scan of a tooth with a little x-ray is not going to show, not to mention that this captures the entire skull, showing the bone density if someone needs to plant implants, and we can show exactly what angles those need to be in to place implants in places that in the past you would have hit something vital or important and had to stay away with an implant. A cone beam lets you plan around those, know exactly where the most dense bone is and exactly where to place it. A beautiful thing. Another example is the monitoring equipment which we use. So sedations at this office are very important. Patients would not feel comfortable at the office in cases where they need sedation. And if you're sedating, you need to be able to monitor it, to make sure that someone is truly getting sedated, but also that someone is safe during that procedure. We're able to monitor their heart, their breathing, and their oxygen levels, among the other things that someone needs to make sure that they're safe during their sedation. Monitoring, even someone who's just comes in as a normal patient but suddenly experiences an emergency in the dental office, having the emergency equipment like the defibrillator to protect them is very important. Intraoral scanners are a very, very important technology. Intraoral cameras, I should say, intraoral cameras are a very important technology. Intraoral camera takes a photo inside your mouth that we're able to immediately put up on those big screens we have in the office TVs. And it's like giving the patient a pair of these loupes and saying, look at your own teeth. Here it is. That's something that you're able to see what's happening with your own tooth. When I'm warning someone about a dangerous spot that needs to be cleaned, they're able to see it for themselves. And it's really nice to put them back, into the dentist seat to see what they're able to see and understand what the dentist is able to understand looking at your teeth. But digital x-rays themselves, taking digital x-rays, being able to clean teeth with ultrasonic instruments, all of these things are shortening your treatment time, creating better recovery periods, making procedures more comfortable, providing more accurate results, longer lasting results. So even the materials that we use for making a crown are very important. Great example was somebody who had needed a crown in the past, they'd avoided it, those gooey impressions actually caused them to gag and have really violent reactions to having the tray in their mouth. Well, that's not an issue when you're using a digital scanner. In their case, we were able to take all the images we needed. They were able to look at it right after we took the pictures. So it was just incredible difference. So technology is something that has made a wonderful difference in a lot of areas, and the dental office is no exception. Proud to be researching and staying on top of it, and I'm really, really happy with the results that we get from things like the three-dimensional cone beam or the 3D scanner. Thank you for your time. I'm Dr. Eck. If you have any questions, feel free to reach out at our office. We include the number in the description, but also if you enjoyed the video, feel free to share it with anyone who you think may benefit from it. Thank you.